When should you use a rectal thermometer for flu? If you're caring for a young child with the flu, knowing exactly how high their fever is can be really important. Using a rectal thermometer is often the best way to get the most accurate reading in infants and very young children. This method is considered the gold standard because it measures the core body temperature, which gives a true picture of how sick they might be. For children under about 4 years old, especially infants and toddlers, other methods like oral, armpit, or forehead thermometers can be less reliable. Their tiny bodies can have temperature fluctuations that are hard to gauge with those methods. A rectal thermometer, on the other hand, tends to be about 0.5 degree to 1 degree Fahrenheit higher than oral readings, making it more precise for this age group. That extra accuracy helps you decide if your child needs medication or if they should see a doctor. To take a rectal temperature safely, use a digital thermometer. First, lubricate the tip with petroleum jelly to make insertion gentle. For infants under 6 months, insert about 1/2 inch. For older children, up to 1 inch is fine. Hold the thermometer in place until it beeps, which usually takes about a minute. Remember to wash the thermometer thoroughly afterward and avoid using the same thermometer for oral and rectal measurements to prevent spreading germs. Use a rectal thermometer when you need a very accurate fever reading, especially if your child has flu symptoms and you're trying to decide if they need medicine like acetaminophen or ibuprofen. Also, if the fever is very high or lasts a long time, a rectal measurement can help you and your healthcare provider understand how serious the illness might be. However, avoid using a rectal thermometer in children with certain health issues, such as immune system problems or specific medical conditions, unless advised by a doctor. For older children and adults, other thermometer types like oral or ear thermometers are usually enough and more comfortable. In home care, getting an accurate fever reading helps you manage your child's comfort and know when to seek medical help. Fever is part of the body's natural defense against flu, but very high or persistent fevers need careful monitoring. Using a rectal thermometer in infants and young children ensures you have the best information to keep them safe and comfortable. Always follow safety instructions and consult your healthcare provider if you're unsure or if your child has special health needs.